Welcome back. Let's focus on health matters now. And women still experience many challenges related to pregnancy and childbirth. Weak health systems, inadequate skilled personnel, and constrained resources are just some of the contributing factors to the persistence of some of these problems. Now, one such problem is fistula, an avoidable condition that subjects women to societal stigmatization. Our in-house Dr. Mercy Korir now goes deeper into this problem. All right, we will have that report by Mercy Korir a little later on, but for now, let's have in studio Dr. Muiruri, who is an expert in terms of incontinence and fistula. Many thanks for joining us here on Weekend at 1. Let's begin with the bigger question. Where can women get help with fistula?
Let's put it this way. Fistula, first of all, is a hole that forms mostly during delivery. And the hole forms because some tissue around the birth canal, they die, where a hole forms into the bladder, where you leak urine uncontrollably. A hole may also form into the rectum, where you leak both urine and feces. So in general, when you go to give birth and you are a right person and you've been following your clinics, you are giving birth under the supervision of a qualified person, chances of developing fistula are very, very low. And that is why, like last week, there was a seminar on fistula at Kenyatta University where they were talking about freedom from fistula, and they were saying they wanted to be zero rates of fistula in a short period of about 10 years.
All right, because that has actually been achieved in the US and the UK. Before we delve deeper into this, let's now take a look at that report by our in-house Dr. Mercy Korir.
Childbirth is a challenging experience for any woman, more so when it comes with complications. It is estimated that for every woman who dies during childbirth, 20 to 30 develop terrible injuries such as obstetric fistula. In Kenya, an estimated 3,000 new cases of fistula are reported each year. Less than 10% of these women are able to access medical care for this. These women form part of 2 million other women living with fistula in sub-Saharan Africa, Arab region, Latin America, and the Caribbean. An obstetric fistula is an abnormal hole or tract that connects the urinary or gastrointestinal tract to the vaginal vault. The commonest is a vesicovaginal fistula, VVF, that connects the bladder to the vaginal vault. Here, women will experience an involuntary discharge of urine to the vaginal vault or recurrent urinary tract infections.
Once fistula has occurred, management should start immediately.
97% of fistula in the developing world are due to prolonged obstructed labor, some that may even be protracted for days or weeks. These fistulas are larger compared to the developed world, where they are smaller in size. 90% of them being caused by gynecological surgeries. Fistula has a profound effect on women's emotional well-being. Many have been stigmatized by society, others abandoned by their spouses.
Watu wakiniona kanisa wanaeva. Naenda mahali fulani, nyumba ya fulani, mwenyewe aoni mzuri kweli. Anasema huyu anakuja kufanya nini hapa? Sangine haribu geti yangu, geti ya kukaa. Kitu kinamwagika kwa. Anamwagika yenyewe.
Fistula can be avoided by delaying the age of first pregnancy, stopping harmful practices like FGM, and timely access to quality obstetric care, especially cesarean section. Fistula is repaired surgically. Persistence of fistula may be an indication to the health system's failure to meet women's needs. Dr. Mercy Korir, KTN News.
And that report forms the basis of our discussion here in studio with Dr. Boniface Muiruri, who is a fistula and incontinence medical service provider. And according to that report, Dr. 40,000 shillings is the minimum needed to treat fistula. But considering that it happens in poor areas and is caused by poverty to begin with, what are the real options for these women who cannot afford that amount?
What I would say, most people with fistula would need surgical repair of the fistula, and that would cost 40,000, if not more than 40,000. One may be in government hospitals where there are gynecologists. We have a good number of gynecologists who can repair the fistula, and the cost would be significantly less than the 40,000. Then we also have some foundations like Amlef, Freedom from Fistula, and a few others which sponsor the fistula repair. The most interesting thing is that most fistula sufferers, they suffer in silence. They are ostracized. They are in the rural areas and they don't want to come out. We always have fistula camps in Kenyatta National Hospital. The last week one was in Katondo Hospital and Kenyatta University. And you find during that camp, we have doctors who are able to identify the sufferers of fistula and book for them free surgery. So that would be an avenue. Maybe we should try to increase the number of people these foundations are able to take care of.
Of course, a lot of stigma also connected with that. But also just taking a look at that report by Dr. Mercy Korir, the doctor in that report, they're saying fistula needs to be treated as soon as it is identified. What complications can arise from prolonging the fistula? There are women who've lived with fistula for 20, 30 years. Is it still repairable at that process, at that stage rather?
I would say, as we said, it's a hole. And as much as possible, the hole should be repaired as soon as possible. But when you prolong the repair, it means the hole may get worse, the fistula may get worse, so it becomes, chances of being repairable becomes more difficult. So the longer you stay, the more difficult it will be to repair that hole. But otherwise, most fistulas, if not all, are repairable. But if you have stayed for so many years, it might be a challenge to get the whole repaired.
And how do you prevent fistula as opposed to treating it, especially in regions that still practice female genital mutilation?
I would say fistula, the best treatment for fistula is to prevent it. And how we prevent it, you find from the report that we've read, somebody delaying his first onset of pregnancy is one way of reducing your chances of getting fistula. So what we are saying is that girls, they need not to get pregnant when they are so young because it means they are still not competent to give birth in the normal way. So delaying the first pregnancy. Then number two is making sure you are always, your pregnancy is always, somebody is always looking at your pregnancy, the first month, the second month, and when it is time to go for delivery, at least you go to a health center that has competent people to do that. So if you do that, you delayed the pregnancy, you are going to the clinics, and you go deliver in the right place. Probability of getting fistula is very, very low, and that is why it has been eliminated in the first world.
Right. Now, fistula, of course, is a form of incontinence, and there are those who cannot manage to get medical attention as soon as possible because of financial constraints, because of access, or just stigma there. But then how can one manage the fistula? Because a lot of stigma comes from the bad smell emanating from the person.
Actually, as we said, I'm not an expert in fistula, but incontinence, products for incontinence that are used, external use products is what we normally talk about. What we are saying is that somebody with fistula is always leaking urine. Some of them will leak both urine and feces. And that means there is a lot of smell emanating from that. It means they are not able to mix with anybody. So the purpose-made products that can be used to manage the fistula, not really to cure the fistula, they are those which you put on that are able to absorb the urine and the feces. They are able to eliminate any smell, and they allow you to lead a near normal life. What it means is that you can be able to visit your relatives, to visit your doctors, and those products are there. There are some which are put on like diapers, the so-called adult diapers, which are able to absorb the urine, huge capacities of urine. And then there are those which are worn like pants, so nobody would know that what you are putting on is something for incontinence. And they enable you to lead a near normal life. And so many people, even those with incontinence, not necessarily the fistula incontinence, they put on those things and they're able to go to their places of work, they're able to go to their social events, the dowries and the weddings, without feeling like there's something
wrong, right? And finally, where can one access these things? The pants, the adult diapers, where can these be accessed?
They are generally available from most of the leading hospitals. We are talking about the products also being available in pharmacies and also products being available in supermarkets. What you go and ask for is, let's say, the pants for incontinence or the adult diapers, but make sure whatever you get is something that can be able to absorb all the urine you are leaking, can be able to neutralize the smell, and it does not have any bad effect on your skin.
Right. And of course, affordability is another question that Kenyans would have to ask. Is it affordable, considering this is, again, something that affects the very poor?
I would say the products are value for money. Probably the name of affordability, it's a big question, because even if something was 5 shillings, it will still not be affordable. But generally, an adult brief or an adult diaper, as they are called, should cost something like 100 shillings per piece. Then the pants are also roughly the same amount of money. We have some other, they are called bed protectors. It's something which you put where you are seated so that it doesn't destroy the linen and everything. There, that one is about 50 shillings per piece. And we have good products by many brand names, including Tena and so many of the others available.
Right.
But the products are there. Affordability may be tungeomba serikali whether they can be made much more cheaper, but they are available, and probably not every Kenyan can afford.
Can afford them, because 100 per piece is quite expensive. If this is a disease you have to manage for a long period of time.
Yes.
All right. Well, thank you so much, Dr. Boniface Mwiruri, an incontinence medical expert there, speaking to us about the options that different women have in terms of treating fistula. The cost for that is 40,000 shillings at minimum. But as Dr. Mwiruri tells us, there are NGOs that can find